Good afternoon. I welcome you all to the Department of Pathology at Sree Balaji Medical College. First and foremost, I would like to congratulate you for having chosen medicine and you have successfully completed your first year. The basic subjects which you have learnt in your first year is anatomy, physiology and biochemistry. What you have learnt is normal anatomy, normal physiology and normal biochemistry. Here, now on, you will learn about the diseases in pathology. The entire curriculum of pathology is based on how you have to approach the patient. What is the causative factor? With that we will start the pathology. So what is the causative factor? What are all the various changes in the organs, in the tissues, in the biochemistry which happens during the disease is studied in pathology. So what you will learn in this process, for an example, Mycobacterium tuberculosis is a bacteria which causes a disease called tuberculosis in human beings. Besides about the organisms, you will learn what are all the changes this tuberculosis produces in the body. Organ level, microscopic level, ultrastructural level and biochemical level. So there are various changes in the anatomic appearance, histologic appearance, functional changes, all this will be taught to you in this pathology. All this will culminate in one process, that is patient diagnosis. That is what are the effects which will all these changes will produce on the patient. Once you examine the patient and you make a diagnosis of the particular disease, again you might need laboratory investigations. For that again pathology will be helpful. Not in all the diseases, all the time pathology. There are certain things which are very essential part of pathology that you will be taught here. So this entire curriculum of pathology is based on teaching you about the causes of the disease, how the changes are occurring in the body, what are all the changes, how will you appreciate the changes and how will you diagnose these diseases. All these things you will learn in pathology. That is 1 year pathology. So we will go on to the introduction of pathology. Yes, now we move on to the main session, that is introduction to pathology. What is the definition of pathology? Definition of pathology is study of disease. You all know you have come across various diseases names, dengue fever, now coronavirus infection, lung myocardial infarction and many other diseases you would have come across from your school days. So study of disease is called pathology. Pathos means suffering, logos means study. Going on to the history of pathology briefly, I would like to recall one famous Tirukkural, my favorite Tirukkural, number 948. Tirukural was written 2000 years ago by Thiruvalluvar. Most of you know, many might not know, few might not know. That is, Noi Nadi, Noi Mudal Nadi, Adu Thanikum, Vai Nadi, Vaipachayal. The entire meaning is when there is a Noi means disease. Noi Nadi, you go approach the disease. Noi Mudal Nadi, find out the causative factor or the changes in the disease. Noi Mudal Nadi, Adu Thanikum, Vai Nadi, Vaipachayal. Use that to treat the disease. That is the crux of this Tirukural. So, Noi Mudal Nadi, that is one important aspect of pathology. Now, how will you approach pathology? There are several methods by which you can study pathology. I go with the way of your learning in anatomy. Anatomy, macroscopic examination. You see the organs, the changes. That is macroscopic appearance. I have put here one slide of normal appearing liver and another is a diseased liver. We call that as liver cirrhosis. See what are all the changes. This is appreciated by naked eye examination. This is first important part of the disease. That is, you see the smooth surface of the liver, the reddish color of the liver in normal. Whereas in the cirrhotic liver, the sizes become smaller, the surface is irregular, and the color is also not the bright pink which you are seeing in the normal liver. These changes are appreciated. This is what is called as macroscopic examination. This is an example. Not all the time we will get liver for examination. Very rarely we will get to make a diagnosis. But these are all the changes which has happened in a patient who is having cirrhosis. So, when these changes occur, what are all the other effects which follow this will be the next level of learning. What is this? There are three people in this picture. There is only one microscope. I know you all know microscopes very well. This is only one microscope. All the people are examining or looking through into the field or examining the tissue section. One section is being examined by all the three, the same area, because there is only one microscope, but they are viewing with the separate viewing lenses. That is called as pentahead. If the 5 people can see, it is pentahead. 10 people can see decahead. We here in our college, we use the pentahead microscope. This is the microscopic examination. Before you take the tissue for microscopic examination, there are several stages of preparation of the tissue for examination. This is called as histopathology techniques and preparation methods. Once you see and study under the microscope, you will learn what are all the changes which is occurred. That is called as microscopic examination. Microscopy is a recent intervention in pathological examination. In 1870, in University of Berlin, Karl Rug and his associate Johann Wett introduced surgical biopsy. Biopsy is not the entire organ or the entire tissue, it's only a small tissue which is taken up for study. That is processed and that is studied, that is the microscopic examination. A full-fledged surgical pathologist was created at Hopkins University and Joseph Holt Bloodhood. He is a surgeon. He became the official pathologist. So pathologists did not start separately, started by the surgeons. I have the picture of Dr. Rodolphe Virchow. There are several diseases named by Dr. under his name Virchow's triad. One example. He is the father of modern pathology. There are so many other people who have contributed in a novel way in histopathological diagnosis of diseases, and they have contributed in the text format for generations to use. The most influential textbooks for you as undergraduates are Robbins and Cotran Pathologic Basis of Disease. The undergraduate textbooks also include the textbooks of pathology by Dr. Harsh Mogan and Dr. Dijender Singh. These two people are living still and working in India. Their contribution towards our Indian students is very great. And another textbook called as Lauren B. Ackerman's textbook of surgical pathology is exclusively for pathologists and surgeons. Undergraduates usually do not use this book, but I wanted to mention this here so that there are so many advances. These are the Ackerman is also a living person. He still lives. He conducts a lot of CMEs and programs. His contribution is very great in medical education of pathology. So, these people have contributed to pathology, especially macroscopic, microscopic, and whatever we are going to mention later. All the methods of study they have contributed in a very great way. Next is histopathological examination. I told you about a biopsy pathology. What is biopsy? You take a small tissue and study. What do you study? In the disease, it's always abnormal histology. In the disease, it is always abnormal histology. Taking a tissue, studying under the microscope in normal anatomy department is histology. It is histopathology here because it's a pathology abnormal. You won't see the normal liver here. For an example, I have shown you the normal liver architecture, that is the hexagon shaped organ, central vein, then peripheral portal triads and radiating columns of hepatocytes in this. See the next one. This is an abnormal pathology. This is called what I showed you earlier, cirrhosis liver. This is what happens in cirrhosis liver. The fibrous tissue in this is highlighted by a special stain. So you see it in blue color. Here in this, unlike the previous slide, wherein it was central vein, peripheral portal tracts and other things, you don't appreciate here. Everything is nodular. The veins have disappeared, the veins are disoriented. So all the disorientation is happening in this biopsy. So the disease study of histopathology is, what is the abnormal histological changes is histopathological study. Next is cytology portion. Cytology, histo is the anatomical orientation of the tissues with each other is maintained in the biopsy study, that you have to take out the tissue and study. In cytology, this is very recently developed in the 19th century and it took its great leap as a diagnostics tool in 1980s. Massively it has been used. Very non-invasive technique. You make a diagnosis of very important diseases. But there are some pitfalls which I am not going to discuss now. What is cytology? Cytology is you study the cell morphology. You study the cell morphology. What is the normal cell? What is the abnormal changes which has happened in these cells? How do you get the cytologist to study material? Using fine needle aspiration cytology, in which you use a needle to prick into the diseased portion. It can be swelling in the salivary gland, swelling in the thyroid gland, or a lump in the breast, or a swelling in the skin, or in lymph node enlargement, or commonly studied using this needle aspiration, fine needle aspiration. Now an advanced technique is ultrasound guided fine needle aspiration. You reach the lesion, study that whether you have reached it with a needle. That is ultrasound guided fine needle aspiration cytology. Another method of cytologic study is fluid cytology. When fluid accumulates in the pleural space and fluid accumulates in the peritoneal space, we call them as pleural effusion and ascites. These fluids can be drawn using the needle and syringe, and then these cells can be studied for the abnormalities. Another important is in the early 19th century, 20th century, that is 1917, George Papanicolaou developed one technique called as pap smear study. Now it is widely used, wherein the scrape method is used to take the tissues. Where can we apply the scrape method? Where you can approach the tissues directly. One example, important example is cervix. You scrape the cervical cells using a spatula, smear it on the slide, make stains, and then study them. That is the pap smear study. This is widely used for cancer screening and prophylactic for screening of the cervical lesions. That another portion is scrape cytology per se is whenever there is an ulcer you can scrape, or in the buccal lesions you can scrape, but you have to see the lesions with the naked eye. For an example, a swelling in the lump, you cannot do a scrape because it is deep beneath the skin. When it is exposed, then only you can do a scrape cytology. This is the appearance of the cytological smears. Whatever you see in the almost all are abnormal cells, but I will say it's not always you will see the abnormal cells. You have to see the normal cells many times in the cytology. You should differentiate what is the normal cell, what is the abnormal cell. For an example, in the left corner you see cluster of cells with a large nuclei, it looks little abnormal. And then on the opposite corner also some cells are having 2 nuclei, 3 nuclei, rounded cells with a large nuclei, all that, this is looking abnormal. Just below it you just see some 6-7 cells, they all look like normal cells. So which organ you are studying and what cells is normal, you should know, which you have learnt. Here what is the abnormality happening in that organ or the particular cell will help you to arrive at the diagnosis. This is cytology. This is one fine needle aspiration cytology of breast. We have made a diagnosis. So you can make a diagnosis of malignancy arising in the breast using this appearance of these cells in this cytology. What are the other methods of study? These are all besides cytology and histopathology. These are little advanced, but histopathology stands as a backbone. Immunohistochemistry is you study the varying cellular substances, highlighting them using special techniques, that is immunohistochemistry. Cytogenetics is you study the genetic changes in various diseases. For that you should know the usual chromosomal pattern. That is, cytogenetics is a separate department of study of diseases. Molecular diagnostics also another portion. Now it is picking up a great momentum. All the diseases are classified based on this. That is molecular diagnostics. What are the molecular changes? What are the DNA changes? Which molecule is affected? Which molecule has undergone an aberrant change? For an example, P53 is a normal proteinaceous substance in the cells. When it undergoes a change and it produces malignancy, we call that TP53, that is tumor P53, like that we implement. Another method is flow cytometry. Flow cytometry is a very advanced test, but it's a very simple test where you can also not only diagnose some diseases, you can also assess the prognosis of the diseases. With this, these are the methods. One method which I have not put in the slide is another is autopsy study. All these studies previously I mentioned is studied on the living patient's tissues, whereas autopsy is done on dead patients. You study the various changes, you diagnose the diseases, and why the diseases caused death in these patients, that has been analyzed in autopsy studies. So I have not given that in this because this is the place. Autopsy is the place where the dead teach the living. That is, you do autopsy, you learn and you apply it on the living patients to arrive at the diagnosis and treat the patient. And this is the brief introduction to pathology I can give you. You will come across numerous new nomenclatures in pathology. Everything you should know what it is. Then only you can go to the higher level of learning about the patient diagnosis, patient management, all those things. You have so many new terminologies you will come across. Please be patient enough to learn the meaning of each and every new word you come across in pathology. With this, I would like to conclude. Thank you all very much. This here you see the pink and blue I have used. This is the crux of or the backbone of pathology, that is histopathology, where we study using shades of pink and blue. Now to conclude this class, in this introduction, we have learnt or we have taught you how to approach a patient with the knowledge of pathology in making a clinical diagnosis of the disease. Also the various changes it produces in the body, organ level, microscopic level, biochemical level, and how will you use the laboratory services for diagnosis of these diseases. The essence of pathology diagnosis is histopathology, which we call as diagnose using shades of pink and blue, that is hematoxylin and eosin, which I have put in the last slide. That is, all these shades will help us to arrive at a tissue diagnosis, which is called as histopathology, which is the backbone of modern pathology. With this, I conclude this class. Okay.